welcome to day 6 of 30 Days of IBS Foods. Today we're starting with another food that may cause some confusion, and it's edamame beans. So edamame beans or soybeans are often avoided with people who have IBS or SIBO because you think, oh, it's a bean, I can't have beans. IBS people can't have lentils and chickpeas and so on. This is a different type of fibre in these soybeans, and I'm going to explain a bit about why they are so good for you. They're a great source of protein for vegans as well because they're high in protein, high in fibre, and a great way to boost plant-based protein content of your meals. Half a cup of edamame beans, which is around 75 grams, which is sort of a normal portion, will give you 3.5 grams of fibre, which is a really good amount for a vegetable. And you can also get around 7-8 grams of protein in that. So for somebody who is vegan, who needs to up their protein from plant-based sources, edamame beans are a really great way to do that. They also contain vitamin K, which is good for your blood, copper, really good for people who are sensitive to histamines, often low in copper, and folate, which is used for so many things in our body. So all of those really important nutrients are there in edamame beans. It's also a good source of fibre, and that particularly this type of fibre has been shown to lower LDL cholesterol and increase HDL cholesterol, which is good for our heart health. Now, if you eat a lot of beans, like over and above this level of around 80 grams per portion, you may get some more impact on your digestion. So, for example, the FODMAP element in soybeans is fructan. At over 200 grams, you may get some of the same sorts of reactions as if you eat some lentils or chickpeas. But you can have a lot more of these before you hit that fructan tolerance limit compared to, say, lentils, where you're just having like one or 2 tablespoons, and you wouldn't need many to hit that same level of fructan. So the FODMAP element is less, the protein element is good, is high for a plant-based source, and there are lots of benefits in terms of our health outside of our digestion. So heart health, I mentioned, and blood from the vitamin K and so on. Now, one of the concerns with soy-based foods is people worry about the impact on hormones. People who've said to me in the past, oh, I can't have soy because of my thyroid or because I'm at risk of breast cancer. So people are worrying that it negatively impacts other systems in the body. Now, the link for soy-based foods and the thyroid has really not been proven, and we don't have good evidence that eating soy can actually negatively affect your thyroid production. Even eating very high levels of edamame beans or other soy-based foods has been shown not to have an impact on the function of your thyroid. There's a lot of misinformation as well about soy-based foods, and actually the benefits are often the opposite of what you think. So there is normally a reduction in breast cancer risk for people who are eating soy-based foods rather than an increase. It's not making things worse, it's making things better. And this may be down to the levels of the fibre, which help to reduce cholesterol. It could be also supporting healthy weight and all the other added nutrients that I mentioned. So if you're interested to try edamame beans, then you can have a good portion, which is around 80 grams, which will be low FODMAP, and anything up to around almost 200 grams is considered low to moderate FODMAPs. So certainly normal portion should not cause you any additional problems. It is great with a stir fry, a good mix of vegetables. Just chuck them in, have it with rice, with like deconstructed sushi bowl with some rice, some beans and some salmon maybe, or on the side of any other meal, just adding a vegetable to your plate. The easiest way to get them in the UK is to buy a bag of frozen edamame beans. I've always got some in my freezer because I really like them, and I will add them to stir fries and things like that. You can buy them in the pods, but you don't eat the skin, the pods, you just eat the beans. So you need to shell them. And that is sometimes how you will get them in a Japanese or sushi type restaurant. The main takeaway I think I'd like you to take from this mini episode is that edamame beans are not in the same category as other beans and pulses. They are worth a try. It's a great way to add some low FODMAP, high fibre foods to your diet. And they're easy, especially if you have the frozen ones that just take a few minutes to cook. Really quick addition to any weekday meal. Join me tomorrow for another food in 30 days of IBS foods.